Hi, I'm Christine Jansen, and I am a registered dental hygienist and massage therapist. I am presenting this video to you guys to give you a little more information about TMJ dysfunction and give you some exercises and tips to help you out and introduce you my new business. I have personal experience with TMJ issues since I was just a teenager, and it led me to recognize that there's a big gap in non-invasive treatment options, especially in dentistry. And after a decade as a dental hygienist, I felt compelled to go a different direction and offer a gentle, holistic approach to treating TMJ dysfunction. This motivation drove me to obtain my license to touch and expand my expertise, ultimately leading to the creation of my new business, Jaw Zen Therapies. So, what is TMJ? That is the temporal, that connects to the temporal bone, mandibular, that's the mandible, our jaw, and joint, that is right here. Now, it consists of two joints connecting our jawbone, particularly the mandibular condyle, to the skull at the temporal bone. These bilateral joints, meaning two, include a synovial joint, a joint capsule, articulating disc, ligaments, and 4 muscle pairs. Now, these two joints need to work harmoniously to not cause any issues. If anything is off balance, it can cause pains and aches. They enable various mouth-to-mouth movements. You can open, close, side to side. You can protrude and retrude the jaw. They're crucial for chewing, eating, drinking, talking, and swallowing. Now you can feel the edge of your mandibular condyles by placing your finger pads in your ears with your palms facing forward and opening and closing your mouth. So, what is TMJ dysfunction? That includes jaw pain. There's pain in or around the joints. That's a common symptom. Joint sounds, clicking, popping, what we call crepitus, which is like a crunching sound. That's not normal if you hear that when you're opening and closing your jaw. Limited movement, lockjaw, whether it's open or closed, or limited mouth opening, that's another TMJ dysfunction. And muscle issues, muscle spasms and pain all around these jaws. Now, there are 3 types of TMJ dysfunction. One is arthritis of the joint. This type involves inflammation and degradation of your joint tissues. And then 2 is internal derangement. This includes dislocation of the TMJ, disc displacement, or injury to the mandibular condyle. And 3 is the most common cause of TMJ dysfunction, and that involves pain in the muscles and connective tissues of the joint. This type can be alleviated through TMJ massage therapy, aka Jaw Zen Therapies. So, what are some common TMD symptoms? One is bruxism, clenching, grinding your teeth, clicking or popping sensations when opening and closing your mouth, and head and face pain, headaches, earaches, dull aching facial pain, especially right behind your eyes. That's all related to TMJ issues. And then sleep issues, sleep disordered breathing, insomnia, and sleep apnea. A lot of it is related to mouth breathing, not breathing properly when you are sleeping, your location of how you are sleeping. And then neck and back pain in your neck, in your shoulders, in your back. You know, a lot of us have this forward head posture that's causing shortening of these forward neck muscles and then lengthening of the muscles in the back of the neck and causing stress in all of this area and causing our jaw joints to have some pain. So what causes TMD? It is a multifactorial disease. There is not usually just one thing causing it. It is usually related to a lot of different factors, from postural issues, that forward head posture I was just talking about, and improper tongue placement that can contribute to it. It also could be related to physical trauma, injury to your jaw, or whiplash, or head and neck trauma that might be contributing to it. Now, emotional factors is a big one. Holding back our emotions like anger, rage, bitterness, and sadness can also contribute to it. Have you ever heard of the term biting your tongue? That also is causing all that tension in our jaw area. And then obviously stress. Stress also causes a lot of clenching and grinding, and so much stress physically and mentally that will manifest oftentimes in our jaw. All right, so TMD treatment options. Jaws and Therapies is my new business. I utilize gentle, non-invasive techniques such as myofascial release. Myo is muscle, and fascial is fascia. That's the connective tissue that covers every cell of our bone tissue, muscle tissue, nerve tissue, blood vessels, everywhere in the body. Covers all down to each cell. And myofascial release utilizes a very gentle, sustained pressure to help ease those restrictions in our fascia. Intraoral massage, I use my experience to go and find those tight muscles within your mouth and release them and help ease those pains. Trigger point therapy also finds those restrictions in our muscles, and I will release those as well. And then Swedish massage, which is a very nice, gentle massage that uses very light pressure to medium and helps with stress. Self-care is another option that includes yoga, meditation, and awareness of bad habits. Now, to really get the full benefit of receiving these treatments, you've got to take care of yourself and your body. A lot of TMJ issues are self-inflicted from us carrying a lot of stress and continue with bad habits. Also, professional care. I like to work with other practitioners such as chiropractors, myofunctional therapists, craniosacral therapists, and dentists to help with dental splints, especially if this chewing and grinding is helping to cause your issues with your TMJ. And then medical interventions, that includes Botox, acupuncture, and muscle relaxants when necessary. Now, this is a really nice visual of where the tip of your tongue should be placed at all times while you are breathing through your nose. Mouth breathing also contributes to stress on our jaw joints. It helps to have your tongue in the proper placement, sealed up on the palate of our mouth. Now, that encourages the nasal breathing. It encourages your teeth to not clench together, and then help to calm all the muscles of our jaw. All right, so awareness and bad habits also contribute to TMJ dysfunction. Poor posture, slouching over, forward head posture, breathing through our mouth because we're just trying to breathe properly and using these accessory muscles up here instead of our diaphragm. And this includes while standing, sitting, sleeping, etc. Teeth clenching and grinding when you are sleeping with your mouth open and your airway starts to collapse, your tongue is falling back, your body in response will jut its jaw forward to open up that airway, causing a lot of us to grind our teeth at night, unfortunately wearing down our teeth and causing discomfort of our TMJ. Poor sleep schedule and position. I encourage healthy sleep. It's really difficult, I understand, but having a proper pillow and sleeping position, not sleeping on our chest and causing pressure on our jaw joints, trying to have support of our neck while we're sleeping will really encourage better TMJ healthiness. Eating hard, crunchy, chewy foods, I love them too, but unfortunately they also contribute to that. Our muscles of our jaw are, limited in that we only get them once in our life. If you are driving a car and using your brakes and you are driving on the gas pedal at the same time, you're going to wear out those brakes way faster. And that's what we're doing when we're excessively chewing, especially hard or crunchy foods all the time. Those jaw joints are going to wear out faster. And holding in emotions, holding back all those anger and those negative thoughts are really not helping with our jaw tension. Nail biting, chewing on ice, again, unhealthy habits. Mouth breathing, including low tongue posture, that's another bad habit. Lack of body awareness and tongue thrust. Tongue thrust is showing low tongue tone and not properly utilizing the muscles in our mouth to swallow, so we'll jut out our tongue, and that's causing issues of narrow palate and discomfort with our jaw joints. So this is why you're here, for that home care for your TMJ issues. I must give you a little disclaimer to always consult with your healthcare professional before making any changes to your healthcare routine, especially these new exercises. We want to have a proper diagnosis. This is just an informational video to help you to find some potential relief for your TMJ issues. As always, don't forget to breathe properly. Doing any of these exercises, always be breathing through your nose as much as you can, and you should never feel any pain. If at any point you're feeling discomfort, you should stop these exercises and consult with your physician. Now, so first thing is posture check. Just check that your joints are stacked all on each other at all points, whether you're sitting or standing through the day. TLC, that is teeth apart, lips together, and calming your muscles and your mind, and that will all help with that TMJ discomfort. Stretches. Now, there are many neck and shoulder stretches to relieve tension. A lot of times us with TMJ issues have a lot of foreshortened muscles here in our neck, so a good one to do is, and always make sure that your posture is straight up before doing any of these exercises. You'll take the one hand, right arm, this is my right arm, and I'm going to go and bring it down to my right shoulder as far as I can without feeling too much discomfort, and you want to hold that for about 30 seconds. And do that on the other side. As with our TMJ, it is bilateral. What you do to one side should always do to the other. And again, 30 seconds on that side. Another one is chin tucks. With your body up straight, you can tuck your chin back and forward and back and forward. You can do that a few times. And neck extension, again, these are just such shortened muscles right here, so it's always good to just go and stretch them as best you can and hold that for 30 seconds as well. Another one is self myofascial release. Now, if you clench your jaw together, your teeth, you can feel that masseter going. So you want to start there, and you want to put slow, sustained pressure with your fingers right into that masseter, and you want it to move up. And this can feel really intense, and if it's too much for you, don't keep going with it. As you're going up that masseter, you'll feel your cheekbone, the zygomatic process, and you'll want to go over that. And you'll want to continue. And as you go over the cheekbone, you'll want to go and start going back to the temporalis, which is a large fan-like muscle on the sides of our temples. And you'll let that go. You can open and close your mouth as you're going, which can kind of help with that discomfort, ease a little bit of that pain. And you can do that as you go all the way back towards the back sides of your head. And then the last one is our teeth and lip trace. Now think of the teeth trace like you've got peanut butter on the outside of your teeth, and you want to start going on the front, and then you want to go all the way around and down and all to the other side, and I'll show you. And you'll want to do that the other way as well. And you can also do it outside on your lips. And with these exercises, I would recommend doing them in front of a mirror. That can help with making sure you're not using any muscles, accessory muscles, to move everything. You want to make sure everything is upright and not utilizing muscles that you shouldn't be using while you're doing these exercises. All right, thanks for joining me today. I hope that I can help you make peace with your jaw pain. I hope that some of these exercises and this information will help guide you to some TMJ relief. I am available as a therapist for you in Jaws and Therapies in Southern California, within Yucaipa and nearby, and I would love to help you on your journey to TMJ pain relief. You can contact me by my phone number or my email or my Instagram for now, and I look forward to chatting more with you soon. Thank you.